Administration of rectal diazepam. Things to consider. Sometimes children with seizure disorders can have prolonged seizures. Longer seizures may contribute to complications. Depending on the student's seizure emergency plan, medication for prolonged seizures may be needed. Given that when a child is having a seizure, it can be a stressful situation, it is highly recommended that you familiarize yourself with the student's seizure emergency plan beforehand. Store the seizure emergency plan in a location that is easily accessible during a seizure. The correct dose of rectal diazepam ordered by the healthcare provider should be locked into place on the device by the dispensing pharmacist. This is evident when the green "Ready" is visible. Be sure to check expiration date on the medication package. Remember to keep healthcare information confidential. First aid for a seizure. Call for assistance if someone else is present. Place the child on a flat surface, such as the floor, being sure not to move the child any more than is necessary. Turn the child onto their side to allow vomit or phlegm to be expelled rather than inhaled. Place something soft under the child's head to protect them from injury. Ensure the child's airway is not obstructed. Loosen tight clothing around the child's neck. Do not restrict the child's arms or legs. Ensure there is no furniture or objects close to the child that could injure him or her. Review the child's seizure emergency action plan. Gather the emergency medication and needed supplies in case the seizure lasts longer than the designated time frame. Procedure for medication administration. Identify that symptoms of a prolonged seizure are present and that, based on the child's seizure emergency plan, medication needs to be given. Note time of seizure onset. Call for assistance if you have not already done so. Assemble supplies and place on a clean surface. Check the medication kit and the medical order to be sure it is, for the right child, the right medication, the right dose, being given at the right time, and being given by the right route. Also check to ensure the medication has not expired. Follow the student's healthcare plan and ensure the appropriate amount of time has passed prior to administering the student's seizure medication. Ask that another school staff person call 911 or emergency medical services and notify parent. Wash your hands if possible. Put on gloves. Recheck the medication kit and medical order to be sure it is, for the right child, the right medication, the right dose, being given at the right time, and being given by the right route. Make sure the delivery device is in the ready mode. While providing the student with as much privacy as possible, remove clothing from buttocks and drape the buttocks with a blanket, pillowcase, or other barrier. Push up on the cap with your thumb and pull to remove the cap from the syringe. Open the package of lubricant. Lubricate the tip by inserting it into the lubricating jelly. Move the student to a side-lying position with the upper leg forward so the rectum is exposed. Using non-dominant hand, separate the buttocks to expose the rectum. Using dominant hand, gently insert the syringe into the rectum until the rim is snug against the rectal opening. Push the plunger in, slowly counting to 3 until the plunger stops. Hold the syringe in place after inserting the medication and count to 3. Remove the syringe from rectum. Immediately hold the buttocks together and count to 3 again. This helps keep the medication from leaking out. Keep the student on his or her side. Keep blanket, pillowcase, or other barrier in place to provide privacy for the student. Note time of medication administration. If alone and you have not already done so, call 911 or emergency medical services now. Monitor seizure activity and respiratory effort. If breathing stops, begin rescue breaths. If breathing and heartbeat stop, begin CPR. Once rescue squad arrives, inform them of medication administered, including type of medication, dose, and time. Remember to dispose of all used equipment and medicine safely out of the reach of children. Remove gloves and wash hands. Document the date, time, and dose of medication given, in addition to what was observed during the seizure. Follow up with the parent or guardian and healthcare provider as needed.